Symbicort Turbuhaler is a medication used for the management of asthma and chronic obstructive pulmonary disease. It combines two active ingredients, budesonide and inhaled corticosteroid, and formoterol to provide both anti-inflammatory and bronchodilator effects. Indications: Symbicort Turbuhaler is indicated for the treatment of persistent asthma in patients requiring both an inhaled corticosteroid and a long-acting bronchodilator. Moderate to severe COPD with a history of exacerbations. How to use: prepare the inhaler. Hold the Turbuhaler upright and with the grip in one direction, then back again until it clicks. This loads a single dose. Exhale, breathe out fully to empty your lungs. Inhale. Place the mouthpiece between your teeth without biting and seal your lips around it. Breathe in. Inhale forcefully and deeply through your mouth while simultaneously pressing down on the grip. You will feel a taste and or a slight vibration in your mouth. Hold breath. After inhaling, remove the Turbuhaler from your mouth and hold the breath for a few seconds before inhaling slowly. Close Turbuhaler. Close the inhaler by twisting the grip back in the opposite direction. Rinse mouth. Rinse your mouth with water after it's used to prevent thrush or other mouth-related side effects. Dosage. The dosage of Symbicort Turbuhaler is individualized based on the severity of a condition. The usual dose may vary between 1 to 4 inhalations twice daily. Your healthcare provider will determine the appropriate dose for you. Contraindications: Symbicort Turbuhaler is contraindicated in patients with hypersensitivity to budesonide, formoterol, or any other components of the product. It should not be used as a rescue medication for acute bronchospasm. Special instructions: Symbicort should be used regularly even if you feel well to maintain its effectiveness. It is not a rescue inhaler. Keep your rescue inhaler like albuterol with you for immediate relief during sudden breathing difficulties. Consult a doctor before changing the dose or stopping the medication. Side effects: Common side effects of Symbicort Turbuhaler may include hoarseness or throat irritation, cough, headache, tremor, nausea, increased heart rate. Serious side effects might include worsening or breathing problems, increased blood pressure, allergic reactions, rash, swelling, itching. Prolonged exposure to high doses may lead to adrenal suppression. If you experience any unusual or severe side effects, contact a healthcare provider promptly.